Okay, so let's get started. As most of you know, I'm Dr. Abdu. I'm the director for the external residency programs, and I'm joined tonight with Dr. Hightouch, who is the director of our internal residency programs. I'm going to start with a discussion about what a residency is, why to do a residency program. A lot of you in your fourth year, sometimes in your third years, you guys have a lot of questions for us about whether or not you should consider it. So I'm going to start with that topic, and then Dr. Hightouch will move on to discuss the match program, and then you will be able to hear from all of our internal and some of our external coordinators to get a little bit more information about the different residencies that we Can everybody see my screen here?
Yes, we can see it.
Okay, perfect. If at any point you have any questions, please feel free to stop me. Just call out or write in the chat and we'll address all your questions later or at the end. Okay, so what is a residency program? Basically, a residency is an intensive postgraduate clinical education that takes place after graduation and really advances competency. It's a minimum of 1 year. Some programs can go as long as 12.5 months with some overlap between old residents and new residents, and some can last up to 13 months. They're not mandatory at this time, but all residents usually take place over the course of 1 year. This is different than fellowships, which can take 2 years or include a residency plus an additional year of fellowship. Okay, so tonight we're just going to be discussing residency programs. It's a specialized training program. So if you have an interest in a particular field of optometry and are interested in specializing with more experience in that field, then a residency can provide that for you. It is not mandatory, but approximately 25 to 30% of graduates complete a residency program. There's over 200 programs and we have over 400 residency positions. Most of the programs will include anywhere from 1 to 12 residents at each site. And the number of positions is constantly expanding. We're developing new programs every year or increasing positions in every program. So what types of residencies are there? There's a number of different categories to choose from. So I encourage you, if you're interested in a residency, the first question you really want to ask yourself is what type of residency program are you interested in? Are you really interested in primary care, or is your passion lying more in cornea contact lens or pediatrics? Perhaps you have more than one interest. Perhaps you're really passionate about both low vision and ocular disease. Nowadays, most of the residency programs have combinations. So I'll show you that a little bit later in the PowerPoint, but a lot of our programs are combined where you can do a residency that specializes in ocular disease, but has an emphasis in, let's say, cornea and contact lens, for example. So if you have 2 interests or maybe even 3 interests, sometimes you can find programs that satisfy all of those different interests. But these are the basic types of residencies that are located in the US. So next question is, why should you do a residency program? So primarily it's for advanced competency beyond entry level. So this will put you a step up compared to your classmates who are new graduates. You will have more experience, you will work with more preceptors, you will advance yourself with more exposure in whatever type of residency you're doing. So it's really going to advance your competency. It's also mandatory for some career opportunities. A lot of VA hospitals or academic institutions will only hire residency trained individuals. Myself and Dr. Hightouch are constantly getting emails from other practices, whether they're OD, MD practices or other institutions, requesting or having a job posting for a residency trained individual that we send out to our residents. So it will open the doors for a lot of career opportunities. It will also put you in high demand if you are applying for a position and let's say you're residency trained compared to a fellow new graduate who is not residency trained. A lot of practices would rather go with a residency trained individual since they will be much more independent and have much more experience and be able to provide some aspect of specialization to the practice. For example, if you performed a cornea contact lens residency, then perhaps you can fit sclerals in their practice, whereas not every practitioner there would do so. It's also an introduction to a lot of scholarship opportunities. During a residency program, you have the choice to be involved in research. Most residency programs require a paper of publishable quality. You will be able to precept students. You'll be able to present lectures. There will be journal clubs. There's a lot of didactic experience that goes into a residency program. It's not only clinical care. So you'll really be introduced to these various types of scholarship opportunities. And of course, the more you have an interest in it, the more you can be involved in that. If you're really interested in presenting, you can certainly find more opportunities to present grand rounds or lectures to classmates or to fellow practitioners. It also aids you in developing a niche in the profession. So if you, let's say, are interested in pediatrics and you do a pediatric residency and you go on to obtain your fellowship and you become well acquainted with the masters of the fields, you can be involved in the different organizations. You can learn more about that specific field of optometry. So it really helps you in developing that niche. Let's say you began that interest as a student, can definitely excel in a residency program there. And working in a residency, you're going to be working with many different supervisors. You'll have your program coordinator, who's the main point of contact, but you'll also be precepted or supervised with a number of other practitioners. So you'll have a lot of different viewpoints. You'll get to see different ways to manage the same conditions. If you're doing an ocular disease residency, you will likely be shadowing a lot of ophthalmologists. So you'll get to see kind of the MD perspective or the surgical care compared to the primary care or optometry care. So that again will be expanded during the program. So with all that being said, are there really any cons to doing a residency program? So I want to address some of the disadvantages that students over the years bring up and discuss why these are cons, but do the benefits outweigh the risks here, the disadvantages? So a residency salary is usually quite lower than what you would make as an optometrist working in any other mode of practice. So there is a diminished starting salary. If you're concerned about loans, remember that loans are always deferred for 6 months after graduation. So for the first half of your residency, that will not be a concern. And then once you have the opportunity to start paying your loans, there's something called income-based payments that you can apply for that allow you to pay a portion of your loans that corresponds with your salary. So you're not making major payments every month and chewing through that salary during your first year of practicing. The other disadvantage that students sometimes are concerned about are the demanding hours and the expectations. But remember that this is not really the same as being a student. You are respected as one of our colleagues or the colleagues of whoever you're working with. You have more hours, yes, and there's expectations, there's deadlines, there's different papers and presentations that you are expected to meet. However, this is really an opportunity for you to increase your exposure, to dive in. You have 1 year to really expand your horizons and learn more and educate yourself and really become very superior in the field in whatever category you're interested in. So yes, the hours tend to be a little bit longer, but again, it's 1 additional year after school. And as opposed to being a student, there's no coursework, there's no exams per se, there's no didactic curriculum that you're really meeting. You're really just focusing mainly on patient care and expanding your scholarship and didactic opportunities. And then the quality of programs can vary. So you really want to find the program that fits best with you. You may find a residency program where you're the only resident, they don't take students, and there's only just a couple supervisors. And you might feel like you do better in a much larger institution, working with many other individuals Perhaps you have an interest in teaching and you want a precept. So you really want to find the program that fits best with your needs, your personality, what you're looking for, and what you hope to obtain or accomplish. It's also important to note whether the residency program is accredited. Now, as an aside to that, we've had a number of new residencies that started over the past year or two. And unfortunately, because of the pandemic, the accreditation has kind of fallen a little bit slower since accreditation must take place in person. However, any program that is currently running without accreditation, that is in the process of accreditation, and that will receive accreditation, all of those accreditations will retroactively accredit all of the residents that completed the program prior to receiving its official accreditation. So keep that in mind, especially the newer programs. But what I mean by this is to be aware of programs that have been running for many, many years that are not seeking accreditation and are not accredited programs. That would be a different situation. And also keep in mind that fellowships, as interesting and as experienced as they are, do not offer accreditation. Only residency programs are accredited by the ACOE. So how to choose a residency program? So a couple of things to consider. First, look at what categories you're interested in. What type of residency do you see yourself doing? Do you have a passion in low vision? Are you interested in pediatrics? If you're not sure, maybe there's more than one specialty you're interested in. The next thing you want to take into consideration is the location. What area of the country are you interested in living in for a year? Let's say you're from a very small town, are you going to tolerate living in the center of Manhattan for a year, for example? So you want to look at the area of the country. I encourage you as much as possible, especially during our situation with the pandemic, but to visit the area that you're interested in or visit the residency program. Get a feel for the organization or the area or the city and wherever you're located or wherever the program's located. You also want to consider the specifics. So what is the reputation of the residency? I highly encourage all of you to reach out to the program coordinators or the residency director for that specific residency. Ask for the residents' email addresses. That's actually available online as well. And reach out and ask as much questions as you have. Perhaps you can meet with them virtually or have a phone call and try to find out as many details in the day-to-day as you can to see if that is something that fits within your requests. After you've applied to a residency program, there will be an interview. Dr. Hightouch will touch on this a little bit more, but remember that when you are doing a residency interview, that does not mandate you to match that program. Remember, it's a two-way street. You can attend a residency program and visit the site and see the area and really just not like it and not feel comfortable there. And that doesn't, there's no harm done. You don't have to match that program. So you are not obligated to match or to go to that residency program if you weren't feeling it. So remember that the interview is very, very important, or any opportunity to visit and to see and to experience that program is very important. And then talking to current or previous residents, the website here, odresidence.com, make sure you guys write that down. That is a website that links all of the residents' email addresses for every program in the country. So you can talk to any resident you have an interest in their program. Where can you do a residency? It's present at all the schools and colleges of optometry in the United States. It's available at most VA hospitals, not all, but half of residency programs are performed at Veterans Administration hospitals. There are many independent sites, private practices, hospital locations, sometimes just group practices have residency programs as well. So again, something to consider what type of residency you are interested in. However, all must be affiliated with an accredited school of optometry. So we have a number of programs and coordinators with us tonight that are affiliated with NOVA that are scattered throughout Florida, and we have one site in Georgia that we'll discuss with you guys their programs tonight. This is a list of our residency programs. These are all of our hospitals and private practices. You'll notice that all of them have two categories. So for example, Clayton Eye Center is a private ODMD practice in Atlanta, Georgia. And this residency is in primary care with an emphasis in ocular disease. If we look down here, Braverman, which is located right here in Hollywood, Florida, it is a residency in ocular disease with emphases in both anterior segment and retina. So again, you can search by the specialty or search by location as well. And then we have our new site, Center for Sight, which is in Sarasota. This residency is in ocular disease with an emphasis in cornea and contact lens. They were just initiated this year. And then we have all of our VA programs. Our new VA program is the Bradenton community-based outpatient clinic that is in Bradenton, Florida. And then we have programs throughout other VAs in Florida. So you can see here that each of them or most of them have different categories and they take different numbers of residents. Bay Pines takes 3 residents, for example, whereas Lake City takes 2 to 3, Orlando takes 2 to 3. So each of them has a number of residents that they accept per year or a number of positions. To get started, contact your local residents or the residents of the program you're interested in, contact the program coordinators, email residency directors. You can look on several different websites, usually around September of your graduation year. So you 4th years at this time is really the time where you want to start reaching out and obtaining information, finding out more about the sites you're interested in. I have a list of websites here. Please feel free to write these down. These are your main resources for obtaining more information on any of the programs and on the program, the programs themselves, as well as the match protocols. We also have some brochures available if you want some more information. National meetings always have residency kiosks that kind of promote residencies and give information about different programs around the US. And then of course, please feel free to reach out to myself or Dr. Hightouch. The both of us are very well versed in residency programs, especially here in Florida. We also have contacts outside of Florida, so please feel free to reach out if you have any interest in any specific program or want us to kind of link you to the right person. I'm going to hand over the virtual mic to Dr. Hightouch.
Thank you, Dr. Abdu. That was a wonderful presentation on residencies. And on the other side of this evening's presentation, I'm going to be talking to you about the application process. Let me just start with sharing my screen. Okay, great. So I'm going to be talking to you about the application process, some of the important deadlines, and how the match works. So once you are thinking about residencies, what are the steps that I need to do next? First, you want to be introduced into the NatMatch website. So it's natmatch.com/ormatch. That is a centralized location where you will start and register for an account. The standard application will start with your basic contact information, your educational information, your NBEO score, your letter of intent, and your CV. So those 2 items is something that you don't have to wait until when registration opens. You can certainly start working on those items. You will need your unofficial transcript and 3 letters of reference. So those doctors that you may have worked with in clinic that can talk to you about how you are clinically and professionally, those are the individuals that should be writing letters for you. Some programs will require supplemental information, so do look into their websites to see if they do require that. And in the application process, you'll need to indicate your program of interest. So be aware that you don't necessarily have to be just interested in one program. You can apply to more than one program. Do note that programs are able to see when an application is started. So that will be in that pending mode, but they won't know or look into your application until the application has been submitted. So here are some deadlines. You're welcome to take some screenshots of this. October 6th is when OR Match application service opens for registration. So that is next week. December 31st is the recommended date by which applicants should register for OR Match. You do want to give careful attention to individual application deadlines for each program. So each program can set their deadlines slightly differently by weeks usually. January 31st will be the cutoff for OR Match to obtain the NBO scores to be sent out to programs. So if your test results are sent out after January 31st, you will need to send those scores individually to the programs that you've applied to. So you do need your NBO Part 1 scores for sure to start OR Match, but Part 2, Part 3, TMOD, those are scores if they are, if the results are out before January 31st, NBO will send those scores out to the programs. February 14th is when ranking opens. So I will talk to you a little bit about ranking in the next few slides here. And once ranking opens, you have 2 weeks, which is March 1st, for when you need to put in your rank order deadlines. So once you start interviewing, you will, after you've interviewed, you will want to kind of make a list of what is your top choice, what is your second choice, and that will be your rank order list. March 9th is the official day for match day. So right around in that morning timeline, you will get an email that will state where you'll be going for the next year. So when March 9th rolls around, have no fear if you don't get matched to a program that that you wanted to go, or don't match to a program at all. From March 9th around noontime till the start of a residency program is considered that post-match timeline. So you do want to kind of be next to your laptops and reach out to programs for any programs that may not have filled a position. I will discuss a little bit about the post-match process in just a little bit. So one of the residency, great resource here for residency programs is a search engine from ASCO. You could put in your area that you're interested in. Perhaps if you want to stay to in a specific state, you can put those information in and it will filter out for you the numerous residencies that are available. Once that filters out for you, you can click on each of those websites and certainly get a lot of information for each of those residencies. So going back to the OR Match website, as an applicant, the first thing you want to do is go to the left-hand side that says applicants. You want to click there. And then you want to register first. So that is the basic information that you'll be putting in. And then you will go into the application process. Then you will rank after your interviews, and March 9th is match day. That is when the results are out. So how do I go about applying for residencies? So do not take applying to residencies as an overwhelming process. The website does have step-by-step instructions as well. I'm going to kind of just summarize that for you this evening. So over to the left, you'll see application overview. There's multiple sections here that starts with the application information. And in the application information section, what you'll do is you'll put in your personal information, typically your contact information, your address, then your educational information and NBO score. So that'll start with your Part 1 scores. Part 2 and Part 3 and TMOD, as I mentioned, will follow along later on. Then you'll move down. Now, once that section is complete, you'll see that there's a green rectangle that'll state that that section is now complete. You'll move on to the next section, and it doesn't have to be specifically in any order. Moving down to the document uploads, that's your letter of intent, your CV, your OD transcript. And this is typically something that you can get on your student account. You can just download your unofficial transcript and upload it in PDF format. And then if that program is requesting any supplemental information, you can add that material in there as well. The next section is your reference letters. So as we discussed earlier, you want to request letters from those doctors who know you well clinically and professionally. And you'll go in this area here. Now you can only, you can ask for more letters from other individuals, but you can only select 3 letters to send to a program. So you'll go into this edit section. And if you hover over to the top middle section here, that will open up to a page where you can indicate their first name, their last name, their email address. And then there's a little note section in there where you can note, for example, the applicant is applying for a cornea and contact lens residency, and you want the letter to kind of tailor to that. Once this is sent out and you've input that information, if you move over to the right a little bit here, that doctor will get an email with a link where they will click on. They'll also, if they don't have an OR Match account, they'll have to create one. But then you can see if they have accepted and will write a letter for you, or if the letter has been uploaded on there. So you can see up here that this letter was received for Tom Thompson, reference writer, and then down below, there was a letter that was accepted, and then one was requested, but it was not accepted or uploaded yet. Then you'll move down further on the left-hand side here. So you'll pick your residency site selection. If you look in the center of the screen here, residency site, you can search for the residencies in here, and it will populate the multiple residencies that you're interested in, and you can select that program. Now, once you select that program, now the program knows that you are applying for that specific program. It will go into pending mode. From then on, you can build that application further and do the submission. So you will go into application submission on the bottom left-hand side here, application submission, where you'll go into assembling the application itself. You'll hit anything that says pending here, and then you'll go into the assemble here where I have my arrow. You'll click on that. Once you click on that section there, you'll go into the assemble and submit section. So that is an area where you can pull from that centralized location where you've uploaded all your documents, your CV, your transcript, your letter of intent, and then you can select the references. So as you can see, there are more than 3 names in here, but you will select the 3 names that you want the letters coming from. And then you will select the program that you want those letters to go to, and you will hit submit this application. Once you hit submit this application, you can see on your dashboard that the application is submitted, but the reference letters have not been received. So you can always go to your dashboard and you can look at the applications and see what has come in, what has been accepted, and go on from there. So I know we have some Canadian students on the call here this evening. So can you do a residency? If you're Canadian, of course you can, and we love our Canadian residents. But there are a lot of important details. You certainly need to be staying on top of your visa. If you're studying in the US from an ACOE accredited school, college or school of optometry, your F1 student visa will need to be turned into an OPT visa. So what is an OPT visa? OPT stands for Optional Practical Training. So it is a temporary employment for practical training that's directly related to the student's major area of study. So in that case, the residency. You must have an unexpired I-20, that is the certificate of eligibility that's granted by the institution. And this point that I'm going to talk about next is very crucial. You want to apply, and you can apply as early as 90 days prior to the end of your I-20 date. And so that is the last day of classes. That's not graduation. And I would confirm this information with our International Affairs Office as well. You want to apply as early as possible in the case that your initial application is denied. So if I was Canadian and I was going to apply for a residency program, I would count back 90 days from the last day of classes. And then I would have all my forms filled out. I would do all my consultations with the International Affairs Office and get their guidance. And the very first day that you can possibly submit your application, that's the day that my application would go in. So waiting around for, that 90-day mark, if you're waiting a month, you've really already killed a lot of time, and that does not play in your favor. So, of course, I don't have all the details to the application process, but I'm going to direct you to our International Affairs Office as well, who can give you further information. The other thing to note is that there is a grace period of 60 days from the end of your F1 to the start of your OPT. But again, I would not wait till the end of your F1 to apply for your OPT visa. The USCIS processing time can take 3 to 5 months. So we hope for more of a 3-month than a 5-month process for sure. There's a website here down below. It is a very precise and accurate website, opttimeline.com. There you can see at what months how many applications have been granted. You can see when an individual has submitted their application, when it was processed, when their check was cleared. All of that information will be on there. So you can kind of gauge a timeline as well. But I wouldn't really wait and kind of see, it's been 3 months. I have 3 months, that sort of thing. Like I said, the very first day that you can submit that application, I would get that application in. The other information I wanted to give you is the International Affairs Office's email, which is another good source to further ask some information. So you can certainly do a residency if you're Canadian. It is much easier if you've already on an F1 student visa. So the next process, now that you've kind of interviewed, you've submitted all your applications, the residency directors will reach out to you. They will set up an interview with you. This past year, we've been doing a lot at the internal program. We've been doing a lot of Zoom interviews, but reach out to each program to see if they are at that timeline doing an in-person interview or if it would be a Zoom interview. The ranking process will start February 14th. That's when OR Match will allow you to start inputting that information. And you have those 2 weeks up until March 1st. That is the deadline when all of your list has to be certified. By that time, all of your interviews should be complete. And I want to give you some pearls in that ranking process. So you want to rank all the programs that would be acceptable to you, and you can rank as many programs as you'd like. You want to rank programs in the order of your true reference. So your top choice is number 1, number 2 listed as number 2. You don't want to strategize this process. Sometimes you get yourself into a hairy situation where you think, I think the program might rank me number 1, so I'll put them number 1 just in case whatever situation might happen. And also do not consider a program where a program might rank you when determining your preference. So there are other rules and regulations with OR Match that I'll talk to you about. And then don't rank any program that you consider unacceptable. So if you rank a program that, you interviewed with them, but you don't prefer them, you wouldn't be happy spending the year with them, I would not rank that program, and you don't have to rank all of the programs that you've interviewed with. If in the situation that you've ranked them and you match with them, that is 1 year that you might not be happy, going to that program, and you'll have to go to that program for the year. So just make very wise choices when you're putting your rank list in. The other thing is, now I want to explain the match to you. This is the match is a very complex algorithm. I think this video does an outstanding job on how the match process works. It's a 2-minute video, so enjoy.
Let's run a match to see how our matching algorithm places applicants into positions. For this match, there are 3 programs with their rank order lists shown above, and 3 applicants with their rank order lists shown below. The algorithm starts with Abel and tries to place him into his first choice, program B. Since program B has ranked Abel and has a position available, Abel is tentatively matched to program B. Next, the algorithm tries to place Baker into his first choice, program A. Since program A has ranked Baker and has a position available, Baker is tentatively matched to program A. We say that the matches are tentative because an applicant who is matched to a program at one point in the process may later be removed from the program to make room for a different applicant that is more preferred. Let's see how that works. The algorithm tries to place Charles into his first choice, program B. Program B only has one position and it is currently filled by Abel. However, the algorithm sees that program B prefers Charles over Abel. So the algorithm removes Abel from the position and Charles is tentatively matched into program B. Since Abel has just been removed from a tentative match, the algorithm tries to rematch Abel. Abel's first choice is program B, but that position is filled by Charles, who is more preferred than Abel, so Abel will not match to program B. Next, the algorithm tries to match Abel into his second choice, program A. Since program A has ranked Abel and has a position available, Abel is tentatively matched to program A. The matching algorithm is now complete, as each applicant's list has been processed and each applicant is tentatively matched to the most preferred choice possible. Tentative matches now become final. Program C has no matches and is left with one unfilled position. You should note that with the matching algorithm, no applicant or program can be forced into a final match until all applicant rank order lists have been considered for the best possible tentative matches. Just remember, you will be matched to the most preferred program on your rank order list that ranks you and does not fill all its available positions with applicants it prefers.
All right, so OR match rules. Once you do your application, you'll need to abide and consent electronically to the OR match rules. So the programs cannot give you an offer or an appointment and require commitment from any applicant prior to the release of OR match results. The program may, though, voluntarily inform an applicant that they will rank the applicant, and the applicant can do the same and let the program know that it plans to rank the program. But neither the program nor the applicant can ask, prompt, or initiate the other side for this information. So statements like "I will rank you first" does not abide by the rules of OR match. So the post-match process, so after March 9th, when the results are out, and if you've not matched to a program, have no fear, there will be plenty of programs that have not matched their all of their positions, and there will be plenty of applicants who have not matched to a program. In OR Match, there will be a database where applicants can view any open and available positions, and that information will be posted right after the match. And the programs will update the number of available positions on OR Match once the match results are released. It is a very, very quick process. So on that day of March 9th, right around noon is when programs can start offering positions to unmatched applicants. So if you wait a few days and say, hey, I'm just going to get over the weekend and reach out to this program, there's a good chance that that position will already have been taken. especially with the ease of Zoom now, you can do a quick interview and grant that position to an unmatched applicant. So if anybody needs any help, I know Dr. Abdu and myself were always available after the match results are out. Reach out to us. That becomes our job that day and days after to help individuals find positions. So we want to wish the best of luck to everyone that is applying this year. We're always available to answer any questions that you have. Here are some important websites, some duplicates that Dr. Abdu has also mentioned. My email is here down below. We also have some residents that are on the call, so if you want to directly send them a message to ask about any questions that you may have, feel free to. Next, what I'm going to do is I'm going to introduce some of the internal coordinators here that will take about 5 minutes to speak about each of the programs. First, I'd like to start with Dr. Steen, who is our ocular disease coordinator, and she will talk to you about the positions and the program.
Thank you. Thanks, Dr. Hightouch. Excellent, excellent turnout tonight. It's wonderful to see colleagues and our current residents. So our current residents that we have with us, we have Dr. Rajiv Badal, we have Dr. Ashley Ireland, and we have Dr. Veronica Acuna this year. So what makes the NSU primary care with emphasis in ocular disease residency kind of an interesting, different residency from many of the ocular disease residencies that you'll see in South Florida is really the diversity that comes from the environment and the doctors that you work with. So not only are you within NSU's primary care and specialty clinics working with our attending faculty as well as teaching third and fourth year optometry students, but also you spend a significant amount of time with subspecialists, primarily in a private practice environment around South Florida. So we're talking general ophthalmology, oculoplastics, retina, retinal oncology, neuro-ophthalmology, glaucoma. It really is a very well-rounded approach. And the subspecialists and specialists that our residents work with truly are so interested in sharing their knowledge and teaching optometry residents. So it really becomes a collegial environment where you really feel like you're taken under the wing, not only by your residency coordinator and the NSU residency team, but also the specialists and subspecialists that you work with. You know, something as a previous graduate of our primary care with emphasis in ocular disease residency, as Dr. Hightouch is as well, actually, that we can really say is how much this residency values not only your professional life, but truly the personal life and the respect that we have and the understanding that we have for the quality of life that comes from being an optometry resident and enjoying your time in clinics, but also enjoying your time in South Florida. So that's something that we really do value as part of our residency. There are more academic centered involvement opportunities, whether those are more teaching or research based. Lately, there has been, just incredible support from some of the subspecialists and specialists for publication opportunities, not just at optometric conference presentations, but ophthalmologic conference presentation involvement. It really is a large family that you become part of within NSU and with the doctors that we work very closely with. So our wonderful residents that are currently here are happy, I know, to discuss with you at any point, and certainly you can always reach out to myself. Like I say, Dr. Hightouch and I, as graduates of this particular residency program, certainly it holds a very close place to heart, and we're very proud to be graduates of this residency program.
And thank you, Dr. Steen. Yes, we are both graduates of the program. So if you have any questions specifically, we're happy and here to answer any of your questions. Next, I'd like to bring on Dr. Green, who will talk about the pediatrics and binocular vision positions and the program itself.
Hi, everybody. So if you don't know me, I'm Dr. Green, and I am the coordinator for our PEDS and BV residency at Nova. PowerPoint mostly just because we have fabulous Halloween costumes each year and you need to see the pictures. Last year we were the Leah symbols. So our program is split. We do have one individual position, which is the pediatrics with emphasis in vision therapy and vision rehabilitation residency. And we consider that the full pediatrics residency is the slang you might hear. And then we do have two primary care with emphasis in pediatrics residents. As a PEDS resident, you get to work in a number of services within pediatrics. So I like to think of this program as a super well-rounded PEDS experience. When you leave, you will be able to handle whatever type of pediatrics or binocular vision case walks into your door. That can include your typical pediatrics and binocular vision cases, your CIs, accommodative cases, regular visual skills cases, as well as vision therapy, strabismus and amblyopia. We do have the autism and neurodevelopmental rehabilitation service, an acquired brain injury and vision rehab service, our sports vision and vision enhancement service, which operates out of our sports med department. Myopia.
Dr. Green, I'm sorry to interrupt. Are you changing slides currently?
No.
Oh, okay. We just had a message. Okay, so Dr. Green is not yet sharing slides. Thank you.
It's not sharing?
I'm sorry, changing slides. Are you changing slides currently?
No.
Okay. We just had a question about
Can
that.
you see anything?
We can see your slide shares.
But it's not in like the presentation setting. So
What's happening?
we just see your main screen and all the different screens that you will be showing, but it hasn't presented in like the presentation format.
How weird. Okay, let's see what's going on here. Give me one sec, guys. I am not a PowerPoint master by any means. Okay, well, if it doesn't work, we don't actually need it to see the pictures. The pictures are mostly just for us. I feel like this might have happened the last time I did this, but this worked.
Currently, we don't have you as slide sharing. I don't know if you took yourself off.
No, I
slide
took it off for a second while I tried to fix it, but I don't know what's going on. Give me one sec, guys. You would think, since I was literally on Zoom with the fourth years like 3 hours ago, that I would know how to do this. Okay. I'm gonna try again. Do you see my slides now?
Perfect.
Okay, this is our Leah Symbols costume that I talked about. Okay. So our services, sorry about that, guys. Technology, you win some, you lose some. So as I was saying, we have our myopia management service. We do work with a lot of patients with special needs, and then we do have opportunities to work with pediatric low vision. So as a resident, you really get to see a little bit of everything in the PEDS and BV realm. Some of the things that make our residency unique include that in our program, you do get to precept from day one. That includes precepting with the fourth year students, occasionally with the third year students, more working in primary care with their third year students, and then direct care opportunities with our specialty patients. So within the myopia control, strabismus and amblyopia, acquired brain injury, autism services, there is a little bit more direct care in those opportunities because those are a little bit more complex patient care opportunities. There are also external observations for outside myopia control in private practice setting, strabismus surgery, hospital-based pediatrics, private practice vision therapy, and neuro-ophthalmology, as well as a variety of screenings. We know that screenings have been a little bit difficult in the last year and a half due to COVID, but there are still opportunities to participate in sports screenings. We have been working with some local professional teams and professional teams that come down to the area for their various off-season trainings, as well as Special Olympics is soon to be reopening for their annual state games. And the National Special Olympic Games are coming next fall to Florida. So we're excited to have National Special Olympics in 2022. We also have opportunities to present and work both workshops and lectures, and opportunities for educational courses, including OEP and COVD. And obviously the best day of the year, Halloween vision therapy. So we are known among NSU for our pediatrics group costumes, and we do let the residents pick what the theme will be. We hope if you choose to come hang with us, that you start brainstorming some great ideas for that. So please, if you have questions, let me know. We hope to see you as a member of our team.
Thank you, Dr. Reen. Next, I will bring on Dr. Sharon Lee, who will talk about the low vision position and the program itself.
Hi, good evening, everyone. Can you hear me okay?
Yes.
Okay, awesome. Wonderful. For those of you that don't know me, my name is Dr. Sharon Lee, and I am the coordinator for the primary care with emphasis in the low vision program. Dr. Marissa Jimenez with me, who is our current low vision resident. So just a couple things to highlight about our program. I'm sorry, I don't have a PowerPoint slide to share with you. But a couple of things. First of all, this is not a low vision program. So we won't be doing low vision clinic all day, every day. And it's really because, you can't have low vision without an underlying disease. So you need to have a strong disease base to understand how pathology affects the patient and their vision, especially those conditions that lead to blindness and visual impairment. So depending on the semester, you may have a day or 2 full days of the low vision service. The remaining days, you'll be rotating through the primary care clinic, our in-house diabetes and macular service, glaucoma service, and then rotating through our external sites for retina and neurology and some of the other specialties. So this will give you the opportunity to maintain care skills and really broaden your ocular disease knowledge. We see our patients of all ages, from our young kiddos to the school-age children, our working adults, older adults. So it's not just limited to the older adults or acquired aging conditions that you may see in some of the low vision programs available. We have 2 clinic sites. One is on our main campus at Davie Clinic, and then the second one within the Lighthouse of Broward. For those that don't know, the Lighthouse of Broward is an outpatient blind rehabilitation center. So we have all of the low vision rehab professionals under one roof. So this gives us really an opportunity to work very closely with them as a team to rehabilitate our patients. This is certainly not mandatory for those of you that enjoy working with students and want to be wet. You have an opportunity to help out didactic in our low vision. This is fairly early in the residency program in the fall, so it also gives you a chance to refresh your knowledge when it comes to some of the low devices, especially if it's been a while since you've had the class and that review. I would say the last thing I want to share is we do have some unique opportunities that our residents have had in the past where you're able to travel through the state throughout the year to see school-age children with vision loss, one or more of our faculty members, and then an opportunity for an overseas trip towards the end of your residency year to the School for the Blind in Ireland to see the patients there. Unfortunately, during this pandemic, we haven't been able to do that, but hopefully we're able to offer these opportunities again in the post-COVID world. So if you like this, but you also enjoy rehabilitation optometry and enjoy working in a team-based approach, this may be an opportunity or a program for you. So please feel out to me, Dr. Jimenez, Dr. Hightouch, and we'll be able to answer more of your questions. Thanks, everyone.
Thank you, Dr. Lee. Lastly, I'd like to bring on Dr. Andrea Janoff, who will talk about the cornea and contact lens positions and the program.
All right, let me get my PowerPoint presentation up. I promise I'll be brief. Okay, so let me just get my gallery out of the way here. So I'm Dr. Andrea Janoff. As was said, I am the primary care with emphasis in cornea and contact lenses program coordinator. And Dr. Abdo gave a great orientation on how to select a program. But I would say I know how difficult it is because there's so many options and so little time to make these decisions. And they're all over the country. And I would say you really want to take a look at and start thinking about what sets one apart from another. So what's unique about our program here at NSU is just being in South Florida. We have an extremely diverse group of patients. So a lot of cultural diversity, which makes it interesting. Patients from Cuba, Colombia, the Caribbean, Canada, Haiti, Honduras, and on it goes. And we really enjoy that. You know, you learn a lot about these cultures. You learn a lot about some of the different conditions that go along with certain areas. And we have Baskin Palmer right here, the #1 rated ophthalmology site. So we do get a lot of referrals from them, and patients fly in from all over the world to go to Baskin, and they're then referred to us for various services. So it's wonderful co-managing experience. So we also have an interdisciplinary team. We have both osteopathic physicians and allopathic physicians now, that's newer, with sites where we can co-manage with these professionals. And it's very easy to get records, you know, information back and forth to each other right at the same location. So we have our primary care medical clinic on the first floor and optometry on the second floor. We have specialty services on the third floor, really makes it convenient. And then in the cornea and contact lens service itself, we're not only just fitting contact lenses, we're ranging the gamut from, you know, basic daily disposable soft lenses to all kinds of specialty lens fits, but we're at the same time doing comprehensive eye exams, DFEs, etc. So as I said before, we're co-managing with Baskin Palmer, which is the #1 again in 21 ophthalmology site rated for the United States. So we get these patients and some of them have very unusual conditions. So we get to see a lot. And what's nice about our service is it's just not, you know, you don't just go through, let's say, a primary care service where you see basic lenses and then one day a week see specialty contact lenses. We're doing it all. So every time you're in the clinic, whether you're doing direct contact lens care or you're precepting students, you're going to be seeing these, you know, range of patients. We have 6 core, I'll call them core contact lens faculty supervisors that you'll be working with. Dr. Nguyen, Dr. Lan Nguyen here is the chief of the cornea and contact lens service. She took over for me when I stepped down in December of 2019. We have myself, Dr. Najman, Dr. Sheenis, and Dr. Zubkowski, who Dr. Zubkowski over here, who are involved in keratoconus and research. Dr. Victor is our new faculty member, who we hope will be doing the same shortly. And she does a lot of keratoconus fitting and management of these patients, just not quite into the research end of it yet. We have myopia control, Dr. Timmerman with the PEDS clinic. She's not pictured here. The dry eye service is in Davie Primary Care Clinic. So we have two doctors, Dr. Lewandowska and Dr. Espejo, seeing patients there. And we like our program so much that 5 of the 6 people pictured here are actually alumni of the residency program here at Nova. So everyone but myself went to Nova for residency, and I did a VA residency in Boston. 4 of the faculty you see pictured here are actually NSU grads. And then Dr. Zukowski and myself are from NECO, or NICO, depending on how you pronounce it. So what else is unique about our program? Well, one of the things I think is really beneficial is our close relationship with industry. So our students get to work 1 day a week with various companies that provide lenses for fitting specialty patients. We, because of the pandemic, had to curtail the hands-on component, but every Friday, almost every Friday, we have a 2-hour presentation with our friends in industry. So we learn a lot about new lenses, new designs, and the pros and cons of their materials. And this is an example of a schedule. So you see here, we had in 1 quarter, 11 of these out of the 12 weeks. We had various companies coming in, anywhere from Bausch and Lomb. We did cellularity, amniotic membranes, Valley Contacts, scleral lenses, synergized sclerals, Cooper Vision, specialty eye care, talking about CRT, Ortho-K for myopia management. Then we also talked about the MiSight multifocal soft lens for myopia management from Cooper Vision. With Alcon, we talk a lot about their dry eye products as well as their contact lens products. With Contimac, we talk about fitting corneal GPs, aspheric and spherical, for single vision and multifocals. Art Optical, we talk about their scleral lens and their new moon lens for Ortho-K. Excel is another scleral lens, and Johnson & Johnson is practice management, which is very beneficial. And you see that our residents have attended pretty much all of them, unless they're out of town for some reason. So we have external site observations as part of this program. You'll be going to the Center for Excellence, and you'll be seeing collagen cross-linking, epi-off, as well as a lot of other corneal conditions. You'll be going to ocular oncology and retina, which was already discussed, and really fascinating, some of the things you see there. And then a more local Fort Lauderdale Eye Institute with Dr. DeCastro. So a lot of variety, and that's what makes it so interesting. What's good about being here is that our administration provides time and support for you to attend various events that we think are crucial to your advancement. So time for industry and CE events. Obviously, if you're presenting a poster at a national event, that's great. You're going to be attending CE conferences that we encourage you to attend. There are a lot of cornea and contact lens residency events just for cornea and contact lens folks that are really fun. And it's all expenses paid. So it's a great time. And you get to meet, other residents from around the country. We have the residents grand rounds where you'll actually be presenting CE. And then, of course, if you have any interests beyond, if you're a cornea and contact lens resident, but you really like neuro, we could always work something into your schedule. So for an elective. It's important to have state-of-the-art equipment, which we do. And we're proud of that. We also have our separate services, myopia control, and dry eye management. Virtual lens fits we can do now with our Oculus Pentacam. We have multiple topographers. So we have a keratograph for meibography and Placido disc topography. We have the Pentacam, and then we have long exam rooms, which is great. Actually, in some of our remote site, one of our remote sites, we have really long exam rooms, pretty long exam rooms here. But safety is important. So we are very big about cleaning in between patients and keeping our protective gear on. Of course, there's lots to do in South Florida. It's a lot of fun down here. You got the fun, the sun, and the interesting wildlife. So this is an iguana that hangs out right outside of the clinic building. Sometimes you'll see him at lunch. If you'd like to go to the Everglades to see more, that's not too far away. This is a little lizard that used to come and visit Dr. Najman and myself when we would swim at her pool. And then we have South Beach, of course, daytime, nighttime. You can't beat it. And then there's never a dull moment. Let's see if this plays. We have salsa verde. We have salsa verde classes in our area. So that's a lot of fun. Some of the students and the faculty have gone to those. And then, of course, we do hope to see you next year. So stay safe, and my students and I are saying goodbye. All right, if you have any questions, you know where to find me, email, or we could talk at the end of the program.
All right, thank you, Dr. Janoff, for that lovely presentation. I'm going to pass, I want to thank all my coordinators, and I want to pass the mic over back to Dr. Abdu for all of the affiliate program introductions.
Thank you, Dr. Hightouch. So we're going to go through our external affiliate programs. Let's start with Braverman Eye Center. Dr. McCollum, are you able to speak?
Yes, I'm here. Can you hear me?
Yes.
Okay, so I am Shay McCallum. I'm the new residency and externship coordinator here at Braverman Eye Center. We have a private practice, ODMD, high volume disease focused practice. It's a single location. We currently use paper charts, but I believe we'll be switching over to EMR by the beginning of next year. Our hours are primarily Monday through Friday, 9 to 5, sometimes 8:30 to 5. We are a geriatric clinic, although we do see young adults and some children. English is the primary language spoken by most of our patients, but we also get patients that speak Creole, Spanish, Russian, and French. We have a 12,000 square foot facility with 16 exam rooms. We have a surgical exam suite. And then our ancillary area for testing is very well equipped. The average number of patients we see or we're seeing pre-COVID were from about 100 to 140 patients per day, depending on the subspecialist. Post-COVID numbers, it's about 100 to 120. Our resident usually sees approximately 12 to 15 patients per day. And that number does increase as the residency progresses. We perform health assessments. No workups are required, as the technicians and externs usually work up the patients. Again, primarily focused on disease, but there are like refractions and contact lens fittings as well. The resident will be exposed to billing and coding, third-party payer systems, and practice management. They will be able to observe our subspecialists, which consist of oculoplastics, glaucoma, retina, cornea, and neuro-ophthalmology. And then you'll be able to observe on-site surgeries, minor procedures like chalazion removal, LASIK, PRK, cross-linking, epi-off, and then off-site surgeries with oculoplastics, glaucoma, and retina. Our program is about 12 and a half months long with a 2-week overlap with our current resident. And then the resident does have preceptorship responsibilities. And we get externs from all of or most of the colleges of optometry. And then pre-COVID, we were getting Canadian students, but we still have yet to get them post-COVID. Our resident does have on-call responsibilities, and typically you'll get about 3 or 4 a month. The resident is on call Monday through Friday from 9 to 5. No on-call during the weekends because ophthalmology takes over during that time. And then during the course of the year, you may have to come in once or twice for, post-op surgery days, or LASIK or cross-linking PRK if like the contact lens dislodges. And then our benefits for the resident, we give the malpractice insurance, which is a full policy, so it does allow you to moonlight. You get 5 days paid off. We give a $500 stipend for meetings that you want to attend, whether it's Academy, SECO, AOA. And then there are paid holidays such as New Year's, Memorial Day, July 4th, etc. And then we do require Florida licensure, and we advise that you apply as early as possible. And if you have any questions, you can contact me at my full name, shalonda.mccallum@gmail.com. And I can type that in the chat if you like.
Yes, please go ahead and type your email in the chat. We'll have each of our coordinators put their email address in there so that students can reach out. So next we have Dr. Townsend from Baskin Palmer.
Hi, everybody. Thanks for inviting us tonight. I think this is a great idea. I'd like to share my screen and just provide a little bit of a video. This is a video we put together last year to kind of try to reach more students, as we were so limited to bringing people into the hospital. And so we wanted to give people an idea of what it looked like from the inside. And a really, say, about a 4-minute video kind of gives us an overview of what Baskin Palmer has to offer. So I'm going to share my screen here.
Hi, my name is Mark Dunbar, and I'm the Director of Optometry at the University of Miami's Baskin Palmer Eye Institute. Baskin Palmer is a global
I think the sound cut out. Can everyone else hear the sound?
Optometry has
Can
been
you
a
hear
part
this
of
now?
Baskin Palmer.
Yeah, no.
Okay, I'm going to go back just a little bit. Okay.
Optometry at
Sorry.
the University of Miami's Baskin Palmer Eye Institute. Baskin Palmer is a global leader in eye care and vision research. It is regarded as one of the world's leading eye care centers, not only in the United States, but around the world. We have perennially been ranked as the #1 eye hospital in America by US News and World Reports in their annual hospital issue. Optometry has been a part of Baskin Palmer's legacy for close to 50 years. In fact, I was lucky enough to serve as a residency supervisor when we began in 1994. Since then, we've had over 110 optometry residents that have completed our residency. They work in all areas of eye care, including private practice, OD/MD co-management practices, VA hospitals, academic university hospital settings, and even within the industry. Our residents have made so many positive impacts on our profession. We feel our residency program offers one of the best residency training experiences in the country. There's no place that offers the kind of rich patient experiences combined with comprehensive didactic educational program while working alongside ophthalmology residents, fellows, and subspecialty ophthalmologists that are considered to be the best in their field. It goes without saying that you will see pretty much everything you can imagine during your residency here at Baskin Palmer. From the routine things that are kind of the bread and butter of eye care, such as glaucoma and macular degeneration and red eyes, you'll also see the unusual and rare things, the things that sometimes just don't seem to make sense. I think it's that kind of diverse experience that is critical in helping you become a well-rounded and well-trained optometrist. It has always been my goal since our program began to help train residents so that by the time you finish your residency, there's nothing that walks through the door that you can't handle. That's pretty powerful. I don't know many places that offers that kind of training and experience. There's no doubt making the decision to do a residency is an important one, but where you choose to do the residency may be one of the most important decisions you make in your professional life. Indeed, that decision may possibly define the rest of your professional career. That sounds exciting to you, and you want to work hard and be challenged every day, and work with some of the best clinical people in all of eye care, and walk out at the end of the year well-trained and confident, and you're the kind of person we want as a resident. We hope you'll come and join us at the U.
My name's Natalie Townsend, and I'm the Optometry Residency Director at Baskin Palmer Eye Institute. When I was in your shoes, I wasn't certain where my optometry career was heading. But after walking into Baskin Palmer, I was immediately struck by the energy, professionalism, and level of patient care. I knew I wanted it to start here. Now's the exciting time in your optometry career. We hope you'll consider Baskin Palmer Ocular Disease Residency as the next step in your journey. Our program is one of the best, if not the best, ocular disease program in the nation. The clinical exposure, mentorship, didactic curriculum, and network which our residents enter is unique and unlike any other in the country. We're looking for hardworking, motivated, and professional clinicians. We are looking for those who are committed to expanding their clinic knowledge and ability to diagnose and treat patients with ocular disease. We want residents who are willing to come to Miami and experience the culture of our city while learning from some of the best in the field. Our residents rotate in various clinics, including our eye emergency department, cornea, glaucoma, retina, neuro-ophthalmology, ocular oncology, uveitis, and primary care. They also assist with inpatient eye consults at the University of Miami Hospital. We have an exceptional didactic program that provides residents with an added opportunity to grow as a clinician. There are daily morning lectures given by our MD faculty. There's an imaging conference for all OD and MD trainees on Tuesdays, and all clinicians are invited to a hospital grand rounds on Thursdays. Further, the optometry department meets weekly to discuss cases and topics relevant to optometry. These are opportunities for staff and residents to discuss different cases, review imaging, and learn different diagnosing and treatment pearls to keep up on our ever-changing field. Lastly, I think the biggest component of our residency program is the friendships and professional networking residents take with them. Baskin Palmer is a family, and this residency provides residents an opportunity not only to elevate their professional practice, but also steer their optometric journey by being part of this network, this family. This network opens doors, and these friendships are everlasting. There's something special about Baskin Palmer. And the moment you step in these doors, I know you will feel it too.
That I think sums it up best. And that's what we wanted to capture in 4 to 5 minutes when somebody says, tell us about your program. So please reach out to me if you have any questions or concerns. We would love to have hardworking people who want to do ocular disease with us. And I look forward to hearing from many of you. Okay. Thank you again.
Thank you, Dr. Townsend. Please type in your email address in the chat for everybody.
Absolutely. Thank you.
Thank you. Next up, let's move across the state to Center for Sight. We have Dr. Vollmer with us tonight, who just started her residency program just a few months ago.
Okay, you can hear me?
Yes.
Okay, hi, how are you guys? Okay, so Center for Sight's in its first year, and we have a residency and our resident in place, and things are going really well so far. So Center for Sight is a very large practice, medical surgical practice, and it's combination of MD and OD, and it has a very large area that it covers, but the resident is primarily just in Sarasota and Venice, occasionally maybe in the Englewood area. It is unique in that it's an ocular disease as well as contact lens residency, which is a nice combination. So we do have several different specialists within the practice. We have retina specialties, which the resident works with, as well as cornea specialists, cataract specialists, plastic surgery, glaucoma. So the resident's able to rotate with all of those specialists, but they also are able to perform a lot of that care on their own. So they're able to perform routine retinal care that they need to do with all their specialized equipment. Cornea, we're able to practice pretty full scope and prescribe autologous serum, use amniotic membranes, prescribe oxervate. So whatever the resident feels they need to do for different ocular surface disease conditions, ocular plastics, rotations, they can watch surgery and rotate with them. Glaucoma, and all of these, we also have our own.
Yes, Baba.
Hello. Hi, someone's volume is on, or microphone's on. So they're also able to observe in surgery whenever they want, because we have our own surgical center. So it's easy whenever there's a surgery, if they want to watch a glaucoma surgery, a plastics procedure, a corneal transplant, all they need to do is arrange it with the specialist and they can just go to the surgical center. We also, because Dr. Salka is the co-coordinator with me, and he's one of the founding members of the neuro-op special interest group and academy. So there is neuro-ophthalmology that's done with Dr. Salka. There's weekly conferences with him every week. So there's a good opportunity to get all forms of disease from the front of the eye to the back of the eye and managing it them out there on their own. The resident does direct care. There's no precepting. We have had in the past student programs, but we aren't currently really active with the students. So there's no precepting. It's direct care. And there's some observation when you're with the specialist. So depending on how that works. The schedule is going to change throughout the year. So there's variety. The contact lenses are done every day that the resident is in clinic, but there's also some specialty lens fittings. So during the day, there's regular soft, toric, multifocal. But if the resident wants to do scleral lenses or other specialty rigid lens fits, they're able to do that. And we have a contact lens supervisor at Center for Sight. And we also work with Dr. Corey Collier, who is in the Sarasota area, and the resident works with him for all of the specialized fitting procedures that they need. So as I mentioned, that there's mostly direct care. The resident does not take call at Center for Sight. It's Monday through Friday, 8 to 5. So they do not take call, but they do see emergencies that come in during the day. They get sort of the first pick for all the ERs that come in during the day. They do have conferences weekly with Dr. Sacco or myself. And the requirements are, the publishable quality paper. We want the resident to go to at least to the academy or possibly more than that. There's no limit on their travel expenses. They just get reimbursed for the meetings that they go to. And so I think that, it's a good variety in medical, surgical, cataract co-management, surgical co-management, corneal surgeries, LASIK, epi-LASIK. So there's a lot of surgical co-management. And it's also a very good practice management model. So there's a lot you can learn in terms of practice management as well. So that part is also pretty impressive. So I think there's a lot of variety there, and the combination of disease and contacts is very good. If you have any questions about the program, just send me an email and I'll put it here in our chat, and I'd be happy to help you.
Great, thank you, Dr. Vollmer. Next, we're going to move on to some of our VA hospital coordinators to discuss their programs. I'm going to start with Orlando VA, Dr. Spalding.
Hi there. It's okay if I share my PowerPoint?
Yes, give us one moment.
Okay.
I'm going to add you in right now as a co-host.
All right, should be coming up here. All right, everybody, thanks for tuning in tonight. We do appreciate it. I guess this is the second year we've had to do this via Zoom, so I think this works well. Saves us a trip down to South Florida, which we appreciate. So why should you all consider the Orlando VA? Just as a reminder, it's centrally located right in the middle of the state. It's one hospital and one outpatient clinic. The hospital is about 6 years old now, and I currently work at the outpatient clinic, but it's a shared residency, which means you kind of go back and forth depending on the rotation. It's not a daily switch between sites, but you will be at both sites throughout the rotation. It's about 29, 30 minutes from one place to the other, but we really only send you to one site per day. It is a residency in ocular disease with an emphasis on primary care and geriatrics. That's what most VAs are. Let me shrink this here. There we go. So what else is going on with the Orlando VA? Let me go to my next slide. So our patients, just as a reminder, at a VA, you're seeing veterans. And most 95% are male, average age right around 60 years old. If you haven't been to a VA as a student, it is definitely worth your time. We're dealing with, Army veterans, Navy veterans, Air Force, Coast Guard, Marines. We don't have any Space Force veterans yet. Who knows when that's coming. What is a VA? Well, VA is kind of all-inclusive. It handles a lot of services. There's ambulatory surgery, there's, audiology, there's a lab, there's a pharmacy, mental health, primary care teams, all the surgical subspecialties are located. We, as optometrists, are part of the specialty clinics. There are also ophthalmologists. So who takes care of the patients in our eye clinic? Well, between the two sites, we have 13 residency trained optometrists. Some of those optometrists specialize in contact lens fitting, some specialize in low vision, and we have one specialist in TBI and vision rehab. We do have training programs, as you know. We have students who come from Nova, MCPHS, Western, and we've also added ICO. Typically, we have 2 to 3 residents. The reason we say 2 to 3 is we're officially funded for 2, so we're guaranteed to have 2. And we've had 3 for the past 3 years, and we would expect that trend to continue. So hopefully we'll have 3 again for the years to come. We do have ophthalmologists on site. We have 1 general ophthalmologist, 2 cornea specialists, 3 retina specialists, 1 glaucoma specialist, an ocular plastic specialist. And the ophthalmologists also have their own training programs. They have 3 third-year ophthalmology residents from Howard University and Texas, El Paso. Their residents are primarily there to do surgeries. That's what they're getting their experience in. Equipment-wise, we pretty much have everything under the sun. The VA is very generous with funding for the eye clinic. Taxpayers are very generous with their funding. What equipment do we have? We have everything you could ask for. And if we don't have something, you're going to suggest it and say, oh, we have this, we had that. We'll take it under advisement and put it on the purchase list for the future. One thing that we're getting ready to upgrade at the Lake Baldwin Clinic is we're going to be upgrading from our Cirrus to the latest Cirrus, which will allow us to have OCTA capability. They do have Spectralis with OCTA down at Lake Nona. But we have, everything that you would need. We really don't want you to have to bring anything equipment-wise. What clinics are you going to work in? Well, the hands-on experience comes in the optometry clinics. That's why you're with us. It's VA optometry, again, ocular disease, lots of primary care, definitely geriatrics based on the population. The optometry specialty rotations, you'll get 3 half-days a month in our specialty contact lens clinic. You'll get about a half-day a month in the low vision clinic, and also a half-day a month in the TBI and vision rehab clinic. It is Monday to Friday, 7 a.m. to 4 o'clock. We don't have any on-call responsibilities, which we're grateful for. The thing I usually remind incoming residents is that could change tomorrow, but it's been this way for a long time, so we don't expect big changes. We also get you time with the ophthalmologists. We do get you doing some observational rotations up in the operating room and in their clinics, both for cataract, retina, plastics, cornea, and glaucoma. We also fill in with some external ophthalmology rotations. We have a neuro-ophthalmologist who's been having our residents rotate with her for many, many years. We have a cornea specialist who does the same, and a local retina group practice. We also get you a little bit of time with some VA providers in the primary care team, the dermatology clinic, and in the neurology clinic. How many patients are you going to see today? That is a question we get all the time at interviews. And so the numbers game is a very tricky balance, right? We roughly have you see 5 to 10 per day based on your rotations. The reason you might say 5, well, you might have spent half the morning in your contact lens clinic, and then the extra half day you're spending in primary care clinic. If it was a full day of primary care, you're probably going to see about 10 patients a day. It's roughly 1,200 to 1,400 patients per year. We really do not require a certain number. We've never put that in any type of official document. We want you staying busy and seeing as many as you can. We do definitely value quality over quantity, but it's a very tricky balance. Variety is important, different patients, but also with 13 ODs supervising, we do want you getting different time with all the ODs, because experience is, part of why you're here. Volume's important. There are resident schedules as well as staff optometrist schedules. There are overbooks and walk-ins, which we usually steer your walk-ins to residents. And ultimately, it's going to be up to you as to how many you're going to see. What other responsibilities will you have as a resident? We do have our residents providing slide quizzes to students. We have residents participating in journal quizzes and discussions. We do have you doing 3 grand rounds presentations throughout the year, submitting a paper or a poster. We do want you to attend a major meeting, to try to get lots of CE while you're doing your residency. We do give you some time off to attend that. The registration, travel, and things like that, unfortunately, are at your own expense, but we give you the time off. We also want you getting involved in the local society. We send you to 3 local Orlando Optometric Association meetings to learn about the business and legislative side of optometry. And we also ask you to give us feedback. So you're going to evaluate us, we're going to evaluate you. And in your last quarter, we do have you supervising some students as much as you can, just so it's not too overwhelming. But the reason we do it is because we never know where you're going to work after you're done with us. You could end up at a school, you could end up at another VA, and we want you having that experience of supervising a student. Are there didactic opportunities? Absolutely there are. We have some training days once a month where the resident does their slide quiz to students, and then we usually assign an article with a quiz. Sometimes there's a lecture. We do have a Wednesday ophthalmology conference when our residents are at the main hospital. On Thursdays, fortunately, Baskin Palmer has been very generous. They allow our residents to log in and join the Baskin Palmer Grand Rounds. And then if they don't happen to have something going, I was able to arrange that Wilmer up in Baltimore is able to do the same thing. In the afternoons on Thursdays, we do an optometry conference where usually either a student or resident's doing a journal, a student's maybe doing a case presentation. It may be time for the resident to go through their Grand Rounds presentation. And then usually we either have a staff lecture or some sort of streaming lecture. Once a month, we also have some central office VA optometry education that's put out. So there's a lot of emphasis on didactics during your residency year with the VA. What can you do in your free time? Well, the good news is Orlando is kind of close to everything. You know, a lot of people come to Orlando for the theme parks. Orlando does have a city, believe it or not. You might say, well, I thought that was Disney World. No, there is an actual city of Orlando. We're relatively close to beaches. I think the closest beach from the main hospital is just about 55 minutes. And that's to the East Coast. The West Coast is closer to about 90 minutes. You know, a lot of sporting activities take place here. You know, there's golf, there's NASCAR racing over in Daytona. You can go and watch a space launch. They happen all the time these days. There are some professional soccer teams in town. There's the basketball team, a hockey team. There are local Florida springs that are very nice to see. There's local Florida wildlife, as all over the state, of course. And then a lot of people come to Orlando for the shopping. So, you know, that's the quick summary. You'll get more once you apply. So you're more than welcome to reach out to me at john.spalding@va.gov. We do appreciate you tuning in tonight. And I really do hope to see your application soon so we can talk some more about all the joys of Orlando residency. And I'll put my email again in the chat.
Great. Thank you so much, Dr. Spalding. Next up, we'll have Dr. Marcus Freeman from the Malcolm Randall VA.
Okay, hello everybody, and thanks for staying tuned in. I know it's a long day. Monday is a long one. But anyway, I'd like to share a little bit about our program. So let me see if I can manage to share my screen here. Okay, so nothing fancy, but a little bit of a breakdown about our residency in primary eye care at the Malcolm Randall VA in Gainesville, Florida. I hope you can all see the slides. I'm the residency coordinator. I think I'm on my 14th group of residents. We take 3 residents. We started out with just 1 back before I took over, and now we have 3 solidly. Of course, NOVA is our academic sponsor. Dr. Abdu, our director, and our academic affiliate is University of Florida's Department of Ophthalmology, which is directly across the street from our VA hospital. Of course, it's a 1-year program like all of them. The salary right now comes in just under $35,000. There's now 11 federal holidays with the addition of Juneteenth, and residents earn actually 13 days of annual leave by the very end of the program. So there's quite a lot of time to have work-life balance. Of course, there's sick leave and malpractice coverage at the VA via the Federal Tort Claims Act. So this is just for work at the VA. And if a resident decides to moonlight.
Sorry to interrupt. Do you have slides up?
Is it not showing?
No.
Let me try
your screen again.
That's okay. You're not missing much, but let me hit share. Hold on. Can you see now?
I think it's coming in now.
Okay, sorry about that. But it's really just everything I said, nothing fancy on these slides. Okay, so a few more facts. Do you have a view there? Okay, so 3 resident position. We have 7 optometrists who work with the residents. So lots of chefs to stir your development. And we have 6 ophthalmologists. Our residency is broken down into trimesters since we have 3 residents. So each trimester is a little bit different. One of the trimesters has a contact lens, little mini fellowship, I call it. We do a very busy contact lens specialty clinic with referrals from other surrounding VA hospitals that don't offer those services, as well as from the VA ophthalmology department. We also have 1 rotation with low vision. So once a week, residents get to do low vision rehabilitation. And what's nice is with both the contact lens and low vision programs, money's not an issue. We provide the patient what they need, so we can be broad-minded in what we provide. You'll see routine follow-up, urgent care visits, all sorts of patients come in, anterior seg, posterior seg, everything in between. Even though you won't see pediatric patients, you'll see lots of binocular vision problems, and we work to correct those and manage those. Residents spend 1 to 2 days a week in our ophthalmology clinic at the main hospital. And there we have specialists who do medical retina and uveitis, glaucoma, neuro-ophthalmology, oculoplastics, and general ophthalmology. There are also medical ophthalmology residents kind of there, as well as medical students rotating through. So there's a nice kind of multidisciplinary setting. Our ophthalmologists work really well with our residents, and they really appreciate our residents, and the residents always give nice feedback about working there too. I provide observations based on what the resident is interested in. So these are external observations in a cornea clinic with Dr. Matt Gray, who's wonderful. The residents give me great feedback about him. Cornea surgery, retina surgery, cataract surgery is available for residents who are interested. We send our residents to the TBI clinic with Dr. Riccozzi for a 2-day observation in Tampa, VA. And also we set up a dermatology day as well. Didactically, we do some lectures internally in our optometry clinic, but we also get to enjoy participating in the UF Department of Ophthalmology's Grand Rounds, which is most Fridays. That can be topics of any ophthalmology sort. So that's where you'll get your peds, maybe not in person, but at some Grand Rounds. Department of Ophthalmology also hosts Pearls for Practice, which is visiting professors. And a few days during the year, there may be a glaucoma day or a neuro day, and our residents are invited to that too. We have local optometric society meetings that our residents are invited to, and they are free members. We encourage our residents to attend at least one major national meeting, but residents do get 5 days of administrative time for this, just like staff doctors do. So a lot of my residents will do 2 days at SECO perhaps, or weekdays, and then into the weekend, and they'll also do academy. There's also courses, unlimited eye courses on our education website. We do an optometry grand rounds where residents can learn from their co-residence cases in the whole North Florida and Florida area. And also there are multidisciplinary lectures on Fridays at lunch. Scholarly activities include grand rounds. Our residents present at a VA kind of regional grand rounds, and also at, of course, the Nova Residence Day. They do a manuscript of publishable quality, and we mentor them very closely with this. And we encourage them to submit for posters at a national meeting. And also there's a poster day with our Geriatric Research and Education Clinical Center as well. But kind of other things that make us special, we have a very good culture in our clinic. We have Cuban coffee breaks 1 to 2 days a week in our optometry clinic. We have a very friendly culture. We care about the residents. We care about them being happy learners. And like I said, in ophthalmology clinic, they're very welcome and a part of the team there as well. Gainesville, it's a cool town. It's got the Gators and the swamp, which is an experience in and of itself. But there's also a lot of natural beauty here. And we're less than 2 hours from a lot of places like Orlando, Jacksonville, St. Augustine, and Cedar Key on the West Coast. So it's kind of pretty central. Anyway, I hope to hear from you if you're interested in a VA residency. If you've been to a VA already as a student, you'll know what a special population we have. The veterans are a pleasure to take care of, and I hope to hear from you in the future. Have a good night.
Thank you so much. Please also make sure you list your email in the chat box for the students. And then next we have Dr. Curry from the Lake City VA.
Is my volume working?
Yes, we can hear you.
Very good. So I want to congratulate everyone for being on. It's a big step thinking about residency. It's also pretty important for all the stuff you've been going through, COVID and all those things. This can be really, really helpful. So I'm gonna skip through some of this stuff because the things Dr. Marcus went through, we're kind of a cousin program to them. We're primary care with a concentration in low vision. We're kind of rural. We're right between Tallahassee and Jacksonville and about 40 minutes north of Gainesville. So we offer a lot of disease, but we also, more than the variety, we also offer a lot of concentration of different levels of those diseases. Our residents have been in a couple months now. They've already had some GCA cases, retinal detachments, uveitis. Down the hall, we have a neuro-ophthalmologist plus retina and glaucoma rotate through each month. They also spend time with the Gainesville VA ophthalmologist and an outside retina specialist. We do have staff providers, and I want to say all of our staff providers, you have at least one peer review paper published where they're the first or second author, and everyone's residency trained. So that's kind of a big deal. And you'll get a lot of grand rounds experience. You'll get a lot of journal club, but we're really, really clinically based. We're going to spend a lot of our time talking through patients and real case scenarios. You'll see anywhere from 6 to 12 patients a day, and you'll work with techs, you'll work with students. Sometimes you work up your own patients, but you'll get a lot of variety. And that's the biggest thing. It's a smaller clinic environment. We really want to get to know you, and we really want to make sure that there's a good understanding of what we're trying to do, working through your processes. So our information is on the NOVA website. So if you're interested, let us know. Thanks.
Great, thanks so much. Also, make sure you put your email in the chat box. I have a few more sites that I want to discuss. Our coordinators couldn't make it tonight, so I'm just going to share my screen and run through a few more residency programs that we are affiliated with. The Bay Pines VA, which is in the west coast of Florida, takes 3 positions. They are a very open door policy. They pride themselves in having a great work environment and optometry team. They have a very high volume of patients. The residents become very comfortable managing a wide variety of ocular disease at this program. They do take on call at the Bay Pines VA. This is great for them. There's always an attending available for them, even when on call, which is a great benefit for residents, so that they can have someone available to co-manage and discuss cases with. There are currently 5 attendings at the Bay Pines VA. So while working with each of these providers, the resident learns different management styles. So for questions, please contact Dr. Greeno. This is her email, as well as the 3 residents have supplied their email address as well. So if anyone would like to contact the resident for more information about this site, go ahead and write these emails down. Next is the Jacksonville VA. This is a relatively new site. They just began, I believe, in 2019. So they're in the process of accreditation right now. They take 1 residency. They have 1 residency position available. The category is primary care with an emphasis in ocular disease. They have weekly rotations through low vision, and then every other week they rotate through a specialty contact lens clinic. So they're getting a very wide variety of cases that they are seeing. They are affiliated with a larger multi-specialty private ophthalmology group. So the residents do get to rotate through a lot of those ocular disease specialties with ophthalmology. And they're working on affiliating with the Jacksonville Ophthalmology at UF. They have 8 full-time optometrists, 7 ophthalmic technicians, the 1 resident, and they take anywhere from 1 to 2 optometry students per term. So there is opportunity for precepting. The schedule is Monday through Friday, 7:30 to 4. The scholarship requirements are presenting 2 CE lectures, one of which will be at the NOVA Grand Rounds, which is in January. 1 paper of publishable quality, and there's some other additional assignments that are assigned throughout the year. The coordinator for Jacksonville is Dr. Michael Mayer. Here's his address below if you have any questions. And then finally, the last program is our Tallahassee VA. The Tallahassee VA is an outpatient clinic. It was built in 2016, so it's relatively new. They have a lot of new equipment. The Tallahassee VA has 2 resident positions available. They're very, very centered and passionate about teaching. 2 of the attendings even sold their private practices in order to focus solely on students and residents and to continue teaching. They also want to encourage residents to become competent and confident as it relates to managing ocular disease. They have low vision rotations, a half day a week for the residents, but they also rotate through a lot of ocular disease. The residents observe glaucoma, cornea, retina, and the other ophthalmologist specialists at the VA. They have affiliations with 7 optometry schools, meaning they take externs from different optometry schools, which gives the resident an opportunity to precept students who come from very different backgrounds, very different schools and different cultures. And it really expands on the teaching out perspective at this program. Just a few pictures of their exam lanes and what the exam rooms look like at the Tallahassee VA. And for any questions, please contact Dr. Brandon Sanders. If anyone needs any of these email addresses repeated, please let me know. But that concludes all of the presentations from all of our internal and external coordinators. We have about 10 minutes left. We're going to open the floor for any questions from students. You can either ask myself or Dr. Hightouch, any of our coordinators. We have many residents on with us tonight, or any general questions about applying or residency programs.
I did see in the chat earlier on that there is a meeting for OPT for the Canadian students. I believe it was mentioned as October 7th. So for any of our Canadian students on, you will probably get more detailed information at that meeting for OPT visas.
Okay, I know we gave you guys so much information today and such a wide variety of programs to think about. Let's see, I see a question in the chat here. Is precepting students more clinic or lab-based for the internal sites? I'll leave Dr. Hightouch to answer that one.
Yeah, so precepting for students, for the 3rd and 4th year students on the internal at the school, at the college, is going to be more really clinic based. The residents do have OTM after hours where they're mentoring, guiding, and assisting students at those hours, but that's not their typical schedule. So they are either at our internal clinics, precepting and seeing patients, or on Thursday afternoons doing direct care where they're directly interacting with patients from beginning to end, or they are at their external sites where they are observing and shadowing specialties in the various sites. They don't do precepting, but some sites do have some student engagements. But mainly our residents at the external sites are the only residents one-on-one with the doctors in the exam room.
I just want to add, for the full pediatrics residency, that's the pediatrics with emphasis in vision therapy and vision rehabilitation, there is a stronger emphasis on teaching experience within laboratory courses. You will get experience in multiple binocular vision and pediatric laboratory courses throughout your residency that does not happen in the other residency programs.
Does anyone else have any questions or comments or anything else you want us to discuss? Okay, well, we want to thank everybody for attending this evening and for your attention. Again, we really look forward to any of you guys applying for residencies or seeking out questions. We're happy to answer any of your questions or discuss any of the programs with you. I just want to wish the best of luck to everybody here as you guys embark on the beginnings of the application process. And have a great night, everybody.
Thanks for joining. Have a great night, everybody.